always knew that I was interested in biology and anatomy, and it was basically by a recommendation of one of my professors that I applied to medical school. And then after I went to medical school and rotated through all the different specialties, I decided that I was going to either do orthopedics or nothing at all. And so fortunately I was able to get into an orthopedic residency and then end up doing what I wanted to do. One of the biggest reasons I chose orthopedic surgery is that we by far have the most variability in what we do. You're dealing with a broken bone, you can be doing a knee replacement, you can be doing an arthroscopy with reconstruction. Being part of UT Health enables us to have a community-based medical care that keeps it here at home. And it keeps the people getting their care at home by people that they know, that they've heard of, and that has a reputation. Particularly over a 27-year period of time, I run into my patients and their family everywhere. I grew up in a very small town in Texas Hill Country, a lot smaller than it is here in Athens. And so I knew what life in a small town was going to be like, and I knew it was going to be completely different than a practice in the city. And by being part of UT Health and a bigger system, we're able to have everything that we have here and everything that we need here in order to deliver state-of-the-art orthopedic care.